once it gets to the vaccination site, it can be actually warmed up to room temperature for a short amount of time. And so once it's in our nursing homes, then it's somewhat back to normal. It gets to room temperature, and the vaccinators work with our nurses to administer it. It should be no different from any other vaccine delivery at that point. One of the keys right now is to ensure that people are prepared to have mild or maybe even moderate side effects after receiving these first vaccines. And that's because these vaccines are very effective. They're potent. They stimulate the immune system very well. And because they stimulate the immune system well to generate immunity, they create symptoms of an immune system's response, symptoms like headache or fatigue or some muscle aches, maybe even a low-grade fever, just for 24 to 36 hours while the immune system is responding. We need to ensure that hospitals, nursing homes, and healthcare settings are fully staffed to take care of the residents under our care. And so there's a possibility that a fair number of people, after receiving the vaccine, healthcare workers, might need to call out for a day while the mild side effects or moderate side effects resolve. And so one concern we have is trying to avoid vaccinating too many people, staff members that is, on the same day, and having too many people feeling under the weather the next day while the vaccine is kicking in. And so we're working to develop contingency plans so that we can have backup staffing. And we're also trying to figure out how we can stagger vaccination among healthcare workers so that the impact of that is lessened.
Pain at the injection site, swelling, is not uncommon. It's maybe 15% of the people. Something like less than 5% have fever for a day or so, and then there is a much smaller percentage that have some kind of diarrhea in the day or 2 days afterwards. We've also set up with Genesis, with Dr. Feifer and his colleagues there, a system so that we're getting their data every day. So every day we will be able to report to them as well as to the Centers for Disease Control and Prevention any adverse effects that we see in the data for the 30, 40,000 people in the Genesis system. So we'll have, in some sense, almost a real-time reporting of these adverse effects. There'll be serious adverse effects. They don't document this person had pain in their arm or so on and so forth. But to the extent that there's a very significant increase in the proportion of people with fever or diarrhea or other like that, we have those data and they come in literally every day. So we'll be able to report on that very quickly. And the Centers for Disease Control was very pleased that we had already set up this system to get the data and transmit it as quickly as this, because it gave them an insight, a view into what's happening in the nursing home setting in a manner that they'd never had before.